Difference between dementia and Alzheimer's. The general definition of dementia is a brain related disorder and it is a syndrome characterized by a group of features that includes attention deficit, memory impairment, judgmental problems, loss of thinking, then loss of orientation. Along with that, there will be agitation, there will be illusion, there will be delusion, then hallucination. So, it's a dementia is a group of syndrome that occurs due to other disease conditions. It's a brain disorder. Alzheimer's disease, it's a type of dementia. All Alzheimer's is a dementia, but all dementia is not Alzheimer's. That is very important point. Okay. Alzheimer's is a type of dementia and it is a most common type of dementia. Dementia always not Alzheimer's, but Alzheimer's always dementia. Okay. So we can see what is the causes of dementia. The etiology of dementia include various disease conditions like Alzheimer's itself is a cause for dementia, then stroke, thyroid issues, vitamin deficiencies, then reactions to medicines, side effects of medicines, then brain tumors. All these are the etiology for dementia. But in case of Alzheimer's, the etiology of Alzheimer's is unknown or idiopathic in nature. Alzheimer's always idiopathic or unknown nature. And we are thinking that amyloid cascade hypothesis is the reason for Alzheimer's disease. So amyloid cascade hypothesis, it is nothing but we have studied regarding the plaque formation in the vessels, right? So here in the brain, especially in the area of memory or cognition, in that area there will be plaque formation. So this plaque contains loads of insoluble protein that is known as beta amyloid. So this beta amyloid, when it is gradually increased, the size of plaque will be increase. So that's why the patient will lose the memory or cognitive function, and it can be progress to hippocampus level. So the plaque formation in the area of memory and cognition, so that leads to Alzheimer's. So that is known as the amyloid cascade hypothesis. Amyloid cascade hypothesis. Okay, here there will be insoluble protein that is known as the beta amyloid, and gradually it increase the size. Based on the increased size, here the person lose the memory or cognition, and all other features will be occur. Then regarding the duration, the dementia permanent damage that comes in stages. The duration, it may take long time to comes to the severe form of dementia. Dementia is divided in 3 stages: mild dementia, moderate dementia, and the severe dementia. So based on these stages, the clinical features will be vary. In mild dementia, there will be mild features, and moderate dementia, there will be some more features, and severe dementia, the person, all the memory functions will be damaged. Okay, so the based on the duration, it may vary and it may extend from the months to years. That is regarding the duration. But in case of Alzheimer's, the average of duration, that is 8 to 20 years. The Alzheimer's, it is divided into two forms, that is early onset Alzheimer's and the late onset Alzheimer's. So in case of early onset Alzheimer's, mostly it will take 8 to 20 years. It will be gradually increase, and sometimes it will be rapidly progress. Okay, so in the average of duration is 8 to 20 years. Then next is the typical age of onset. Typical age of onset, mostly dementia is older age problems. Okay, so mostly 65 years or older affects with the dementia. But in case of Alzheimer's, we can't always say it's an older age problem. Okay, I already said that there is early onset Alzheimer's disease and late onset Alzheimer's disease. So early onset Alzheimer's, it can be occurs at the age of 30, and late onset it can be occurs at the age of 65. So the typical age of onset may different for dementia and Alzheimer's. Then regarding the symptoms, I already said that there will be issue with memory, focus, attention, judgment, visual perception, reasoning, judgment, comprehension. All this will be impaired in case of dementia. In Alzheimer's, there will be difficulty in remembering newly learned things, and with advancement, there will be disorientation, mood, and behavior changes. Especially, the person will be in depression. The person will not be able to remember anything. Especially, he learned things he not able to remember. So, a lot of behavioral problems will be occurs for this patient, and mostly in dementia, there will be frequent awakening in the night. And Alzheimer's also, there may be chance for the sleep disturbance, and we can't say that it is frequent awakening. And the usually the dementia is insidious onset. It is gradually will be occur, but Alzheimer's may rapidly progress to severe form. Then regarding the treatment for the memory problems, we are giving cholinesterase inhibitors. Then for the mood problems or the behavioral problems, we are giving the antipsychotics, then serotonin reuptake inhibitors, then sleep disturbance. All this we can use the drugs. But both dementia and Alzheimer's, they are incurable disease. Okay, this, for some extent we can control the disease by using drugs. And here most important thing is the person's relatives should be educated well regarding the take care of the patient. Otherwise, it's very difficult to deal with this type of patient, because they will not be remember their son or father, whatever it is. They're not able to remember. Then they're not able to do their daily routines properly. Okay, so lot of patience needed for the relatives. Then another typical example for Alzheimer's disease is the Tanmatra film. Malayalam Tanmatra film is the best example for the Alzheimer's disease. And if you see this film, definitely you will not forget the Alzheimer's disease. And sorry for the disturbance. So this all regarding the difference between Alzheimer's and dementia. I hope you understood. Thank you so much.